pain, ouch, I don't like it. It makes me tired. It makes me cranky. It prevents me from walking my dogs and having fun. In addition, ouch. The most common cause of chronic pain, chronic means persistent, is low back pain. Now, there's arthritis of the spine. There's spinal degeneration. If the spine is degenerating, it's pressing down on all the nerves coming out of it. And then there's a disc problem. A disc problem. Disc, let's say what a disc is, first of all. Your spinal bones, called vertebrae, are separated, and there's cushions in between them. They're separated so you could bend over. The cushions are called discs. They're largely made out of fiber and collagen protein. And if they get herniated, they press in on the nerves, and that really hurts. Many of the causes of low back pain have to do with nerve damage. Sometimes it's nerve compression from one of these herniated discs, and that includes sciatica. That's a very common pain. We'll talk about that later in the program. And then, of course, there's the pinched, compressed nerves in general. Then a second most common cause of chronic pain is arthritis. We cover arthritis in our other episodes. Then there's nerve pain, what we're really discussing today. Nerve pain is a catch-all term, including but not limited to peripheral neuropathy. You often see peripheral neuropathy in people who've had diabetes for a certain amount of time. Then there's shingles-related nerve pain. When you were a kid, you had chicken pox, and later on, when you're older and you're stressed out, it comes back with a vengeance. It's called shingles. And then there's sciatica, which seems to happen to so many people at some point in their life. We will cover each of these, their causes, their customary treatments, lifestyle changes, and supplements that can help them. Welcome to our Nutrients for Nerve Pain episode. Hi, my name is Jerry Hickey. I'm a licensed pharmacist who also has studied nutrition. I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about how some very important nutrients, Alcar, ALA, benfotiamine, certain forms of B vitamins that are active can be used individually or combined together to strongly improve nerve pain. Interestingly, besides their ability to reduce nerve pain, some of these nutrients are actually healing for your nerves. Be sure to subscribe to the Invite Health podcast today and leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get started. Let's talk about peripheral neuropathy. Now, neuropathy is damage to the nerves that causes pain, numbness, tingling, crawling feeling on your skin. Peripheral neuropathy is nerve damage outside of the brain or spine. It's the peripheral nerves. The most common cause of peripheral neuropathy is diabetes. It's commonly referred to as diabetic neuropathy, diabetic peripheral neuropathy, diabetic polyneuropathy. Other causes of neuropathy could be autoimmune diseases, kidney disease, HIV, or abusing alcohol. By the way, when they discuss diabetic neuropathy, they generally talk about damage to the nerves in the hands and feet. But bear this in mind. This is a word of caution. If damage is happening to the nerves in your hands and your feet, it's also happening to nerves in your digestive tract. In fact, some people wind up with gastroparesis. The nerves in their stomach are damaged, and food travels too slowly out of their stomach, draining into their intestines, and they get all kinds of symptoms. And even diabetic cardiac autonomic neuropathy, which is damage to the nerves of the heart, which is absolutely scary, and nobody's really addressing that at all so far in America. So when these supplements that I discussed later on this program help nerves in the hands and feet, they're also addressing nerve tissue in the heart, nerve tissue in the abdominal tract. I mean, it's all over. So what do you normally use for neuropathy? What do they use for treating neuropathy in diabetics? Usually antidepressant medications, like tricyclic antidepressants. They're the most effective form of antidepressant. These are the oldest type of antidepressants. They reduce nerve pain by about 50%. They're known as like amitriptyline, Elavil, nortriptyline, desipramine. Then there's drugs that were originally designed for convulsions, like Neurontin, which is gabapentin, or Lyrica, which is pregabalin. They can help. Some of them make you feel very sedated, very tired. They're pretty much equally effective with antidepressants for reducing nerve pain. And then there's opioid medications, the heroin-related, poppy seed-related, not poppy seed, poppy plant-related medications. I strongly recommend you avoid those because they are addictive, they make you nauseous, and they cause severe constipation, and they don't work that well. They really don't. They shouldn't be used for neuropathy. Now, we're going to a quick break.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Welcome back to the podcast. So let's talk about other things we could do for neuropathy. Let's talk about a supplement called Alcar and a supplement called ALA. I tell you, I've used these on people with different forms of neuropathy for decades. They help dramatically. I used to recommend them separately, and I found out they worked so much better when you put them together. It was an additive effect is adding 1 and 1 to equal 2. So if you add one supplement to another and you get twice the benefit, that's an additive effect. This is stronger than that. It's a synergism. In other words, adding the Alcar to ALA is better than getting both benefits added one on top of the other. It's like 3, 4, 5 times better. So Alcar is a supplement often used for mental focus, for brain energy, for memory. It can even help a condition called tinnitus, that ringing in the ears that affects so many millions of people. Alcar, which is the abbreviation for acetyl L-carnitine, it's an amino acid related supplement. When you swallow it away from food, it easily crosses over the brain's protective blood-brain barrier and enters your brain and improves brain energy and brain health. Lots of research on that. However, it works really well for nerve health, especially if you mix it with the second supplement, abbreviated ALA, which stands for alpha-lipoic acid. Both Alcar and ALA are natural to the human body. They're involved with converting calories to energy. And some research shows that combining them gives better results. I've seen that in my practice. ALA, alpha-lipoic acid, is, just to give you some info on that, it's excellent for like liver health. Somebody has a bad liver, this stuff is fantastic. It helps convert calories into energy. It's a super powerful antioxidant, anti-inflammatory agent everywhere in the body. It goes into both water-soluble and fat-soluble compartments. In other words, it goes everywhere in the human body and acts as an antioxidant. But it's very good in the brain. So here's a review. A meta-analysis, a systematic review. It's in PLOS One. PLOS One is a great American journal. A systematic review means that these researchers went through all these different medical websites to look at all the studies and collate them, and then they do a meta-analysis. They look for studies that are looking at the same situation, like can Alcar help diabetic nerve pain? Can Alcar help peripheral neuropathy? So they look for studies that are similar, that are looking for a similar outcome, but they also make sure that they're honest studies, that they're lacking bias, and they're well reported and well designed. So they found 4 randomized controlled human clinical trials with Alcar, 523 patients all told. It significantly improved nerve pain. According to the patient, it significantly improved their nerve pain. And this was not placebo. It was better than placebo. Don't knock placebo. Placebo is just like retraining the brain to ignore chronic pain. You're not supposed to feel pain when you're sitting still. Pain is supposed to be a warning not to move something you might cause further damage. For instance, if you break your leg, once they put the cast on and it's still, the pain goes away. So when they're giving you a placebo, basically they're tricking the brain to retrain itself to ignore the pain. That's not a bad thing. And it does work to a degree. So they found that Alcar worked whether you injected it or you swallowed it, and it worked really well for diabetic nerve pain. It helped other nerve pains, but it seemed to really stand out for diabetic nerve pain, which is the most common cause of nerve pain, by the way. Now, we're going to a quick break.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Welcome back to the podcast. So here's a review of treatments for nerve pain. It's from the Integrative Medicine Center in Oklahoma City and the Department of Neurology, Wake Forest School of Medicine. Wake Forest School of Medicine's in Winston-Salem, North Carolina. It's in current treatment options for neurology. And they're saying, here's what we find helps nerve pain. Exercise, a better diet, certain forms of B12, Alcar, ALA, and vitamin D. If you're deficient in vitamin D and you bring your vitamin D levels up, it can help nerve pain. So that's only going to help people who are deficient in the first place. But they said certain forms of B vitamins, Alcar and ALA, exercise and diet. Well, that's pretty much what I'm saying. So here's the Nathan 1 trial. It's in the journal Diabetes Care. It's from the University Hospital Dusseldorf in Germany and the Institute for Clinical Diabetology, the German Diabetes Center. So it's a whole bunch of these academic research centers. It's 460 diabetic patients with mild to moderate diabetic nerve pain. And they gave them ALA, so they're not even using the Alcar, they're just using the ALA. The other review was just Alcar, this is ALA. And it really worked. They found that the ALA really helped suppress nerve pain. It really improved nerve health. Leg function improved, leg strength improved, nerve pain declined. It really had an effect. And it prevented, in those where, in all of them, it prevented nerve pain from worsening. But there was a great improvement in many of them. Now, I have more research studies showing similar things, that the Alcar or ALA are very good for diabetic nerve pain, whether you swallow them or they're injected. Because in Europe, they often use them as injections. In America, they often use them as supplements in a capsule or tablet. But don't forget, if you're a diabetic and you have some nerve damage in your hands or feet, you might have cardiac autonomic neuropathy. And it's important because doctors really aren't looking at that yet. That means that the nerves controlling the heart are not functioning well, and that's rather scary what the outcome could be. So while the Alcar with ALA are addressing the nerves in your hands and feet, they're good for nerves everywhere. Nerves everywhere, including in the digestive tract, in the stomach, and in the heart. Now, chemotherapy is a common cause of nerve pain and nerve damage. Chemotherapy to treat cancer. So just let me say this up front. I've often recommended Alcar while people are actively getting chemotherapy. It's good for their brain, it's good for their heart, and it helps prevent nerve damage, and it helps prevent treatment-related fatigue. But I don't normally add the ALA until they're finished with the chemotherapy. The reason for that is ALA is such a powerful antioxidant that it can interfere with some chemotherapeutic drugs. Now, the effects of chemotherapy normally last for 3 weeks after the last infusion. They usually give it by injection. It usually lasts for 3 weeks after the last infusion. So I get permission from the medical doctor, the oncologist, to give the Alcar to help these patients. And then 3 weeks after the last infusion, the last treatment, I'll recommend adding the ALA, because when you mix the alcohol with ALA, it's very good. And in general, here's what it helps in patients being treated for cancer. Some of the chemotherapeutic drugs are nasty for nerve health. They can damage the nerves, they can cause nerve pain, numbness, tingling, etc. But some of them can also affect the heart. They can also cause fatigue. They can also affect the memory. It's called chemo brain. And that's a bit of a misnomer. It's not just the chemotherapy. It's the angst and anxiety and depression of having cancer. The cancer itself causes inflammation that can affect the brain. Then there's radiation, there's surgery. I mean, there's a lot of things going on. There's uncertainty. So here's cancer chemotherapy and pharmacology. It's the University of Wisconsin Carboni Cancer Center. And what they found is if they gave Alcar, it was preventing the damage to the nerves, the pain in the nerves, going to a very high level. In other words, if they gave Alcar, some of these chemotherapeutic drugs are so powerful, they still had some nerve damage, but it never got exceedingly painful. It kept the nerve damage down to a minimum. Now, in another study, Sapienza University of Rome, it's in the European Review of Medical Pharmacology and Science. They're looking at 2 randomized clinical trials looking at ALA for chemotherapy-related nerve damage, neuropathy, nerve pain and nerve damage. And they found that it meant something. They found that platinum compounds tended to cause nerve damage, like carboplatin and cisplatin. That's well known. But Alcar really seemed to improve it after, of course, the chemotherapy was finished. And here's the last one I'm going to read, the most interesting one to me. It's in Experimental and Therapeutic Medicine. It's Chinese researchers, Chinese scientists, looking at patients undergoing chemotherapy. And what they did, they gave the Alcar to help with the chemotherapy-related nerve pain and nerve damage. And they found a couple of things were happening. It was 239 patients treated for cancer who developed nerve damage. And they gave them Alcar every day for 8 weeks or placebo. So 118 patients received Alcar, 121 received placebo. And they found out over the study period, they looked every month, that nerve pain was greatly diminished. And that the nerves were actually starting to heal. See, this is the thing about the nutrients. The drugs used for nerve pain, like the pregabalin, the amitriptyline, the gabapentin, they can help nerve pain, but they don't do anything for healing the nerve. The Alcar with ALA in a number of studies have been shown to actually restore sensation, actually restore function of the nerve. They actually help regrow nerve tissue. They actually help heal damaged nerves. So they found at the Alcar group a big drop in pain, but an improvement in nerve function. But also, here's the thing, it alleviated the cancer fatigue. They found that not only was it helping with the nerve pain and helping heal the nerves, but it helped with brain fatigue that was related to cancer. That's often called chemo brain. Chemo brain can last a month. Chemo brain can last a year. People could be depressed. They could be anxious. But frequently they're extremely mentally fatigued and forgetful. We should go to a break. Let's go to a break.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. Pharmacist, nutritionist Jerry Hickey for Invite Health Podcast. We're talking chronic pain today, nerve pain. And now I'd like to discuss sciatica. Sciatica generally comes out of the spine. It's a common condition. It's down the buttocks. It runs down the leg. It can run all the way down to the foot if it's very severe. And it's usually coming out of the spine. The lumbar disc 4 or lumbar disc 5, if there's a herniation there, it can compress the sciatic nerve. Or there's a band of muscle across the lower back called the piriformis muscle. If that gets inflamed, it can squash down on the sciatic nerve. And this pain could be severe and extreme and last a very long time. There's stretches for sciatica. They really do help, so learn the stretches for sciatica. They are tremendous. Walking and exercise do help when you can get to that point. I commonly combine biocurcumin 5-loxin. That's a supplement we spoke about recently in several podcasts that one had to do with brain health and one had to do with arthritic pain. I combine that with Alcar with ALA and we get excellent results for sciatica. So here's a couple of studies. This is the journal Neurological Regeneration Research. It's the University of Florence, the Department of Neuroscience, and the University of Catania, that's in Italy also, the University of Camerino in Italy, and the Department of Experimental and Clinical Medicine, University of Florence. And they're looking at both gabapentin, which is Neurontin, or Alcar, to help with sciatic pain. And they found that Alcar and gabapentin over a 14-day period both helped tremendously with pain. They both help tremendously with pain. So giving Neurontin, which is gabapentin, or giving Alcar both helped relieve pain caused by sciatica. However, the only one that was improving nerve health was the Alcar. Once again, the drugs, they could be, by the way, you can mix Alcar with ALA or Alcar or ALA with any drug used to treat nerve pain. It's safe to mix them together. But only the Alcar and ALA have some healing ability. So here's a different study. It's in the journal Clinical Drug Investigations. It's the Orthopedic Institute in Milan, Italy, the Gaetano Pini Orthopedic Institute. And it's 64 patients with really sharp backache and moderate sciatica, so they really have pain. And they treated them with either Alcar or they treated them with ALA for 2 months. They didn't give them together, unfortunately, because giving them together seems to work better. Either one was effective for treating the nerve pain caused by sciatica. In fact, it was from a herniated disc, the L4 herniated disc. But they found it was actively healing. It was improving nerve function while it was reducing the pain. And they found that 46% of the people on Alcar no longer needed additional pain medication, and 71% of the ALA patients, 71% of the people on ALA no longer needed pain medication for nerve pain. I just want to mention post-herpetic neuralgia. Someone, when they were a kid, if they got the chicken pox, which is the varicella zoster virus, it sticks around forever. It sticks around forever. And later on, when these people are generally older and very stressed out and fatigued, it comes back with a vengeance. It's called shingles. It's the herpes zoster chickenpox virus. And generally they get a kind of a scab. They get a sore, but they get nerve pain. The sore goes away rather rapidly, but the nerve pain can last for years. And if it's in a bad spot, it can actually be dangerous. I have seen zero research on Alcar with ALA with shingles nerve pain. However, I've seen it help people dramatically. Okay, so I haven't seen any research on it, but it's very safe to use. I mean, in all these studies, when you use Alcar or ALA or use them combined, they're as safe as placebo. Placebo's a fake pill. So I knew it'd be safe, but the results I get in people with shingles nerve pain is rather dramatic. I mean, I've seen the nerve pain go away very quickly, respond very quickly. Now let's discuss fibromyalgia. But before that, let's go to another very short break. We'll be right back. Jerry Hickey for the Invite Health Podcast.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
As far as, welcome back, pharmacist, nutritionist Jerry Hickey. We're talking about nerve pain today. As far as pain syndromes go, fibromyalgia is probably the most common. It's about 1% of men, almost 4% of women. So it's pretty widespread. They get pain over their whole body. And they get a really heightened perception of pain. They're very sensitive to pain. For instance, if they pick up a coffee cup, it can actually hurt. It can literally hurt. Or if the wind hits their face. In fact, in some people, it's so severe that even inhaling a strong odor like perfume can trigger nerve pain. They're very tired. They have excessive fatigue. They're not sleeping well. They're very stiff in the morning, and they have a lot of anxiety. This is common in fibromyalgia. Now, I've seen a number of supplements help fibromyalgia patients. A form of CoQ10 called ubiquinol has even been studied in children with fibromyalgia. It's helped them. Biocricmin 5-loxin has helped. But in this study, patients with fibromyalgia, it's in clinical and experimental rheumatology. It's the Department of Neuroscience, University of Turin in Italy, and the Department of Psychology, and the Rheumatology Unit, Sacco University Hospital in Milano. And they took 65 women, more women than men have fibromyalgia, 65 women with fibromyalgia syndrome, and they gave them a powerful drug, duloxetine, or they gave them Alcar every day for 12 weeks. Both of them, either the supplement Alcar or the drug duloxetine, both of them led to a good improvement, where they reduced pain, they improved depression. Alcohol with ALA, by the way, is a fantastic antidepressant. It works very quickly. It gives you mental energy. It really improves your mood, and it's really very safe. So that's another thing. But in this study, in women with fibromyalgia, not only did it reduce the pain, it greatly improved their depressive symptoms. It really improved their quality of life. So here's what they said. These findings confirm the efficacy of duloxetine or Alcar. However, the Alcar is also efficacious in improving depressive symptoms, pain, and improving the quality of life in fibromyalgia patients. Now, let's talk about carpal tunnel syndrome. Carpal tunnel syndrome is a compression of the median nerve, and it causes your hands to be numb and tingling, and your hands are weak. Like people with carpal tunnel syndrome, when they pick up a cup of coffee, the coffee might spill. They might drop the cup because their hands are so weak. And they're not responding properly. The nerve muscles, the nerves in the hand are not responding properly. So what happens when there's pressure on your median nerve? Your median nerve is the nerve that runs down your arm into the middle of your wrist and into your hand, and it affects every finger except your pinky. And it passes through a tunnel in your wrist called the carpal tunnel. And so it ends up in the hand. It runs down your arm. It goes through a tunnel in your wrist called the carpal tunnel and winds up in your hand. And this improves the movement and feeling of your thumb and your other fingers, not your pinky, like I said before. And the symptoms are typically tingling, numbness in the palm, numbness in the thumb, numbness in your index finger or middle fingers, burning sometimes, weakness in the hand, like trouble holding things, shock-like feelings. These people could get like a shock pain going down their arm, tingling. Once again, Alcar. This is CNS drugs. It's the Department of Neurology and Psychiatry, Sapienza University, the Department of Neuroscience, Niguarda Hospital in Milano, Milan, Italy, University of Genoa, and a whole bunch of other academic research institutions throughout Italy. And they're looking at carpal tunnel syndrome, and it's a multi-center, so it's all these different hospitals and research institutions. It's 120 20 affected hands, 120, and it's a 4-month study. And they gave them Alcar, and they checked them, before the study. They checked them 10 days into it, 2 months into it, 4 months into it. And they found out it really made a difference. They found out it improved the Boston Carpal Tunnel Questionnaire and the neuropathic symptom inventory, the pain inventory. In other words, there was a real improvement in conduction velocity. Once again, the Alcar was healing the nerves, and there was a real improvement in feel, but the pain, particularly like squeezing pain and pressure pain, really improved. There was a real improvement. Alcar with ALA, I have found it helping people. I've used it in all kinds of conditions where there's nerve pain. I've used it in people who've had nerve pain because there was a problem, a dental problem. They had dental surgery and there was an issue. I've used it in people who've had injuries. I'll give you, for instance, a mountain climber. This lady who's a mountain climber who deals with me, she hurt her ankle and she heard me talking about the Alcar with ALA, and it really helped her nerve pain. She had developed severe nerve pain in her leg. I've used it in people with nerve pain from sciatica. It travels down the spine and down the gluteus maximus and down the leg. People with shingles-related nerve pain. People with diabetic nerve pain. People with nerve pain from chemotherapy. People with nerve pain from multiple sclerosis. I mean, I've just seen it again and again and again help people with nerve pain. There are some forms of B vitamins that are somewhat helpful. There's the active form of folate, which is methyl tetrahydrofolate, the active form of B6, vitamin B6, which is pyridoxal 5-phosphate, and the active form of B12, which is methylcobalamin. They do help to a degree. But a form of B1, I think, may be a little more significant. It's called benfotiamine. It's a fatty form of B1. There was a study in the journal Experimental and Clinical Endocrinology and Diabetes. It's from the University Hospital Gießen and Marburg. That's in Germany. It was a phase 3 study, double-blind, placebo-controlled, 165 patients with diabetic nerve pain. They gave them different strengths of benfotiamine or placebo. The benfotiamine was as safe as placebo. And if they use 600 milligrams, it really helped the nerve pain. Now, that's an important point. I've seen studies where they've studied benfotiamine at 100 milligrams, 200 milligrams. It didn't really help. But when you go over 300 milligrams, it really seems to help nerve pain. I've seen studies where they use 600 milligrams a day, like 300 milligrams twice a day. It really has helped nerve pain. And, of course, it was safe. So there you go. It was safe. You didn't have all the side effects you may get with some drugs. Here's the clinic in Lindenfels, Germany. It's in the International Journal of Clinical Pharmacology and Therapeutics. And once again, they're looking at patients with diabetic neuropathy. It was either type 1 diabetes, which is an autoimmune type of diabetes where your own immune system attacks and damages the cells in your pancreas that release insulin, or the type 2 diabetes that you commonly see in adults. And they gave them either, once again, benfotiamine or placebo. Once again, the benfotiamine was as safe as placebo. Placebo is a fake pill. But there was a statistically significant improvement in the neuropathy score. In other words, sensory perception was improving a little bit, so there seemed to be some kind of healing effect. But the most pronounced effect was a real reduction in nerve pain. So that pretty much wraps it up for today. Just to review, I've seen Alcar with ALA help many, many people with nerve damage and nerve pain. And it's been very safe, and it's good for the brain anyway. So, I mean, you get a double benefit, right? I've seen certain forms of B vitamins, the active forms of folate, B6, and B12 help people with nerve pain. And I've seen benfotiamine help people with nerve pain. And they're all supported by research. Thank you for tuning in to the Invite Health Podcast. You can find all of our episodes for free wherever you listen to your podcast or by visiting invitehealth.com/podcasts. Make sure you subscribe and please leave us a review. Follow us on Facebook, Twitter, and Instagram at Invite Health Today. We'll see you next time on another episode of the Invite Health Podcast.